Hi, I'm Dr. Arjun Handa, plastic surgeon and body contouring expert at Handa Aesthetics and Plastics. So today I want to talk about buttocks augmentation. So butt augmentation or buttocks augmentation is often sought out by many patients of mine because it's a marker of femininity and also a marker of beauty in these days. Everybody wants a curvaceous, large and beautiful buttocks. Sometimes they want a very large buttock, sometimes they want a moderately large buttock, but sometimes they want a buttock which is adequate for their size. However, there are many options to get this done, and which is the best procedure in a certain individual is left up to the plastic surgeon and the patient getting it done. But it is important to know all the options, their relative advantages and disadvantages. So today I'm just going to be giving an overview of the different procedures which are available and you can choose accordingly. So the most common procedure is buttock fat grafting. This is the gold standard procedure. This is the best procedure that is available, and if enough fat is available in a patient, that is definitely the procedure one should choose. Simply because it uses the patient's own fat to augment the buttocks. And buttocks are one of the most favorable sites for fat grafting, which means that the fat grafted is taken up very beautifully and there is hardly very less fat loss as compared to other areas of the body such as the breast or the face. So around 60 to 70% of the fat survives after being grafted. So let's say if I graft around 500 ml of fat, around 350 to 400 easily will survive and around 100 ml will be lost. Another advantage of doing buttock fat grafting is that the fat which is harvested from the back and from the tummy and also from thighs, they end up getting slimmer as a result. So what you end up having is an even more curvaceous figure and a beautiful body. The disadvantage of fat grafting is that you should have enough body mass index that is slightly on the higher side, maybe around 23 to 27, so that enough fat is available. If the body mass index is too low and the patient is too thin, then we just don't get enough fat to give any adequate result. In those cases, other options come into play. Another disadvantage of fat grafting to the buttocks is the prolonged post-operative period. In the post-operative period after fat grafting, the patient cannot lie down on their back for at least 4 to 6 weeks. They cannot sit directly on their buttocks for 4 to 6 weeks. They have to use a special cushion because any kind of pressure on the buttocks will just kill the fat. And the period is essential because it takes 4 to 6 weeks for the fat to settle down and to be properly taken up by the body. Sometimes I've even had patients coming to me at 5 or 6 weeks when they suddenly develop fat necrosis and sometimes some leakage of fat from somewhere. But that usually happens when they don't follow the post-op protocol. In about 100 to 150 cases that I have done, this has probably happened once or twice. In all the other cases, when the post-operative instructions were followed properly, no complications occurred ever. It is a beautiful procedure, it gives very good results, and you can easily see our results on our Instagram page or some of our YouTube videos. Next option for buttock fat grafting is silicone implants. Now this is a good option for patients who don't have enough fat in their body. That is to say, only when fat grafting is not an option do we choose to think about implants. Most of the people do not like implants because it's a foreign body. They don't like the feeling of an artificial body inside their buttocks because they're going to sit on it always and they're going to feel the foreign body every time they sit anywhere. So it's not a very common procedure in India, at least. Maybe in Europe it's very common. But the advantage of silicone implants is that we do not have to rely on fat, and other advantage is that there are less scars because we can just put the implants into the buttocks. The post-operative period is again prolonged because patient cannot sit or patient cannot put pressure on their buttocks for at least 3 to 4 weeks. And also there has to be some kind of revision or exchange of implants after 15 to 20 years. Next, we come to the last option of buttock augmentation, which is body fillers. These fillers are lactic acid based or hyaluronic acid based. The biggest advantage is that it's a decay procedure. It is just an injection into your buttocks and there is no downtime. You can get it done and go back home and enjoy the new figure. The biggest disadvantage with buttock filler injections, either lactic acid based or hyaluronic acid based, is the temporary. The result lasts for only 2 to 3 years, after which the buttocks will again shrink and a repeat procedure will be needed. Another downside which compounds this complication is the fact that these fillers are very expensive, because a large volume is injected and combined with the temporary nature of the fillers are not routinely chosen by our patients because of the economical value. So these are some of the options that you should know about buttock augmentation. Our recommendation is always to get fat grafting done if enough fat is available. Even if enough fat is not available, at least one session of fat grafting to give as much result as possible, which can later be supplemented 6 months later by implants or body fillers. So now you know all the options and what we recommend, and now you can choose your procedure. Thank you.